So when you heard about this octuplet birth, what did you think? What was your first response?
Well, initially, almost everyone thought this must be fertility treatments, because this just doesn't happen that often in nature, although it has. But more likely than not, fertility treatments were involved. Problem is, we don't know what happened here. No one's talking.
What's your read of the situation as far as you've heard or you've sort of seen? We've heard about it possibly being frozen embryos that were implanted. Does that seem consistent with what you know?
Well, the story changes on a daily basis. At first, there wasn't infertility treatment, then there was IVF, and now we're hearing frozen embryos. And again, this morning it wasn't fertility treatments, according to the mother. So no one knows the real story. But whether it was IVF or whether it was frozen embryos, we don't transfer 8 embryos in a patient.
And tell us a little bit about the guidelines that have been set up to say how many eggs or embryos should be implanted.
Correct. Well, IVF has been practiced in the United States for many years, and we've been keeping track of data. And we, the American Society of Reproductive Medicine and the Society for Assisted Reproductive Technologists, and we use this data to help us understand practice and maximize practice. Based on our data, we've come up with guidelines that have been modified over the years, and our guidelines state, under the age of 35, 2 embryos is the maximum number of embryos that one puts back. Now, when we're talking about frozen embryos, those guidelines are liberalized because frozen embryos do not make pregnancies as efficiently as fresh embryos. So there's a little bit of wiggle in that. And there's always wiggle in the practice of medicine because not all patients are the same. But the guidelines are pretty clear, and we all follow them.
So there's no case in which you can see it making any sense to implant 8?
I've never done that, I never will, and I don't understand anyone who would.
What would your reasoning be? Why would you say to her, let's not do this? This doesn't seem to be smart.
Well, see, this is the thing. Most patients, when you talk with them and you educate them, make good decisions. I don't think most people know the risks of multiple gestation. Even singleton pregnancies, when you carry 1 baby, that's called a singleton pregnancy. In that circumstance, there is some risk. Now, 2.6 per 1,000 babies get cerebral palsy when you have singletons. When you go to twins, that number becomes about 13, 14. When you go to triplets, that number becomes 45. So you can see this exponential increase in risk as multiple gestation increases. That's not good medicine to expose your patients or their babies to that. We have our patient, the infertile couple, but we also have the babies. They're our patient too, and we want to do what's right for them.
Is this something she could have done on her own, or did she need a medical doctor's help?
Well, this is another thing that's been speculated. Could she have done this without a doctor? And the answer is absolutely yes. She could have illegally gotten fertility drugs, injected herself without monitoring, not knowing how many follicles she was making, done self-insemination, which is doable, not even that difficult to do. And it's possible that there was no doctor involved. We don't know. The fact that no one's identified a doctor in this process at this late date makes me wonder what really went on here. We don't know.
It seems like it's too complicated a process to just do it at home.
It's not too complicated, but it's incredibly dangerous and foolish because there are much safer ways to have a baby. And if you want to have a baby, you want to have healthy babies. She's lucky all these babies are alive. There are some statistics that say half of these babies have a chance of dying within the first year of life when you look at this kind of pregnancy. That's not a good outcome, not for anybody.